Hello and welcome everyone. Thank you for joining us this afternoon, evening, or morning, depending on where you are. My name is Antu Hossain. My pronouns are she, her, and I am the Global Health Impact Officer at CanWaCH, which stands for the Canadian Partnership for Women and Children's Health. Though you're all joining us, all of us, from across different locations today, many of you are in the comfort of your own home. For me, home is Toronto, and I'm grateful for the stewards of the land who have made it possible for a settler like myself to live, work, and learn on the traditional lands of the Haudenosaunee, the Wendat, and most recently, the Mississaugas of the Credit. And today we are thrilled to speak about this amazing presentation that is titled A Partnership Model Measuring Linkages Between Nutrition and Gender Equality as part of the series on the Canadian Collaborative for Global Health. So thank you for those who have joined us recently in other sessions, as well as new folks with us today. I am lucky today to be joined by my fantastic colleagues, Jessica Ferne, Director of Global Health Impact, and Melody Tondeur, Manager of Metrics at CanWaCH. Over to you, Melody.
Thank you, Antu. Bonjour à toutes et à tous. Le webinaire se déroulera entièrement en anglais, mais sachez que la plupart des présentatrices et des présentateurs sont francophones, donc vous pouvez poser vos questions en français. Le webinaire sera enregistré. Et je voulais porter votre attention sur la façon de poser vos questions. Nous vous demandons d'utiliser la boîte Q&A en bas à gauche pour les poser, tandis que la boîte du clavardage en bas à droite peut être utilisée si vous avez des problèmes techniques. Et comme Antu l'a mentionné, notre collègue Tina est aussi francophone, donc vous pouvez lui poser les questions francophones également. Merci à toutes et à tous. Over to you, Antu.
Merci, Melody. So we have a very, very rich agenda today, and so I am very thrilled to be joined by a trio of fantastic partners. Trio because there are three, but that means that their team is mighty in many, many ways. We are joined today by folks from Campbell Collaboration, the University of Toronto, and Nutrition International. So I'm going to hand it over to them. They will be going through their presentations, and then we will open it up for Q&A at the end. So Sara, I'm going to turn it over to you. Sara Wuehler works with Nutrition International's surveillance team for evidence-based contextual relevant interventions. She seeks to build capacity to conceptualize and implement quality nutrition programs worldwide. Over to you, Sara, to get us started.
Okay, next slide, please. We'd like to acknowledge with this presentation that there are contributors to this work across many countries, both within and beyond our three organizations. And just a reflection, the quality of and gender work of this project will feed into data collection for Nutrition International in the current situation and also beyond all of this craziness that's going on right now. Next slide. So today we will be describing the process we've gone through with this partnership, some of the methods and results, and finally where we are headed next. Next slide. To introduce this, I would like to start with a bit of a story about what happened behind this project. To explain, first of all, Nutrition International conducts multiple surveys each year across Africa and Asia. And although we have a standard set of indicators, each survey used to be individually designed, which meant that for anybody who's done surveys in the past realizes that when you design a new survey, there are always errors that creep in. And because of that, we never had time. We were always putting out fires instead of having time to conduct research on the design of the surveys and to improve how we were implementing our surveys. So about 5 years ago, we decided to create and test a set of harmonized survey tools. And this began with a collaboration with Action Against Hunger because of the systematic approach of their SMART tools, and also with Oxford Policy Management in Nigeria because of their fantastic training and supervision. These are a couple of organizations that we worked with at the outset of this project. We titled our project or our approach the Nutrition Intervention Monitoring Systems, or what we like to call NIMS for short. And the first round of surveys was implemented in 2017. Next slide. So once the first set of surveys were implemented, that coming year came to go with some serendipity that so 3 intersections that resulted in this collaboration. First of all, with round 1 of the NIMS surveys completed, we were ready to improve the NIMS toolkit. Nutrition International employs content experts all the way from vitamin A to zinc and from birth to pregnancy, but we don't have the combination of time and expertise to build quality metrics for our surveys and to develop indicators linking nutrition, gender, and empowerment. So a second intersection at this time is that we were involved with a project with the University of Toronto where they developed some cross-country surveys with a set of quality assessments that were aligned with the needs that we had. And the third intersection was that the University of Toronto team at Campbell Collaboration and Wuehler Research Institute was conducting research with us with nutrition, gender, and empowerment indicators for, I'll let Alison describe that a little bit more, but with respect to adolescent girls. And then, of course, the last component, which is our little magic wand here, is that the CanWaCH grant made it possible for us to bring together these 3 sets of expertise into one collaborative effort. Next slide. In this collaboration, the Campbell Collaboration leads the research on the intersection of nutrition and gender. The University of Toronto is leading the research to inform the NIMS quality metrics and related updates. And Nutrition International provides the program-specific perspectives and expertise for these research projects. Team members from all 3 organizations are, as you can see with the circle we have here, we engage in free exchange. It's an iterative process, it's an interactive process, and it also includes challenging each other with our ideas and our approaches, and this has been resulted in both individual and joint and interrelated outputs and action points. So now I'd like to pass on to Daniel Sellen, who is a co-PI from the University of Toronto.
Thank you, Sarah. Thank you, everyone, for joining us on the seminar today. So I'm Dan Sellen. I'm a professor of global health, anthropology, and nutritional sciences at the University of Toronto, where I also direct the Lawson Centre for Child Nutrition. And as Sarah just described, we were delighted to build on prior work with NI and others to work on what we're describing today in terms of our partnership, which is essentially a set of goals behind strengthening the NIMS toolkit that Sara just kindly outlined. So specifically, our collaborative from the University of Toronto's piece was to create a leaner and more efficient and easier to adapt toolkit that could be implemented across a range of contexts to really streamline, speed up, and enhance the quality assurance of large-scale nutrition monitoring. And our second goal was to work further with the partners to standardize the survey process, attuned to the needs of NI and its particular implementations to improve data quality and the comparability of data across projects. So before I pass on to our real lead team person at the University of Toronto, I'd like to just highlight how this collaboration aligns so well with the objectives of the University of Toronto in general as a major public research university. So we see ourselves as a major social investment for the public good, and our real expertise, our brand, it lies in the area of the development of high-level scientific tools and well-informed and up-to-date approaches to research design. And we've applied this to the needs to improve program needs in nutrition monitoring and improve accountability. So it's for us a great use of the type of expertise that we have in real world applied contexts. We also benefit a lot by the capacity that the partnership and the funding has brought to our campus to create a team of some of the world's best thought leaders and experts, which is not just the faculty. We've engaged a good number of professional staff, research staff with a great deal of experience, a great deal of innovative strengths, and also a number of professional trainees at different levels, undergraduates, masters, trainees, postdoctoral students. And so we're able to leverage our work on the project into our other work as a university aimed at building a critical mass of world leadership in this type of area. And in turn, this collaboration, I think, has strengthened Canadian-led partnerships. We're able to take some of the things we learn as a team at the university from this particular collaboration, and it helps us generate approaches, ideas that have knock-on benefits across our work with other partners in the sector. So we are very, very pleased to be involved. We're learning a lot, and we feel like we're able to have impact in the ways that we're best able to do. And so with that framing, it's my great pleasure to pass on to our project lead at the University of Toronto on this, Victoria Sauveplane.
Thank you, Dan. Great, the slide already changed, perfect. So now I'll be presenting a bit more our approach and the details on how we enhance the existing NIMS, so the Nutrition Intervention Monitoring Survey tools, to ensure quality and accountability. Our approach generally was not to, go back please. Thank you. Was not to reinvent the wheel. So we took inspiration from a number of existing survey tools and manuals. The backbone to the enhancing the NIMS components really relied on the standardized monitoring and assessment of relief and transitions, also known as the SMART methodology. It is typically used in more humanitarian contexts at both subnational and national level, but their field practicalities, attention to data quality, and sampling procedures were key components for really enhancing these tools. We also were inspired from UNHCR's standardized expanded nutrition survey, which also has the same backbone of SMART, with their standardized data analysis templates and syntax, which we all know in terms of statistical software, it's not always obvious to produce the similar results. And also the CDAT checklist, so it's a complex emergency database checklist that was produced a number of years ago to really streamline and standardize the reporting processes of nutrition surveys. So with this consolidation of multiple survey methodologies and tools, we produced a iterative and kind of quite comprehensive package with a number of checklists to make sure that we're streamlining the number of processes, tools for protocol development, with standardized templates, ODK forms, which stand for Open Data Kit, mobile data collection questionnaires. So we're also streamlining the sequence and how questions are being asked and recorded, and a number of quality assurance metrics and tools that I'll touch in a bit more detail shortly, and also, as mentioned, the reporting templates. Next slide, please. We also wanted to make sure that the various components of the toolkit were also specific to the different target audiences. So Nutrition International, they're the leading force of these surveys, evidently, and they have a series of tools that are specifically adapted from their point of view to oversee the whole process of how a survey is being implemented by a hired implementing agency. So as a number of agencies are working with different agencies or organizations or partners with the ministries of health, we want to make sure that everyone had a clear set of tools based on the roles and responsibilities within the NIM survey process. So here we can see that the team leaders have a number of quality assurance tools, which are different from the field supervisors, which are also different from the survey managers. So this way, we have a comprehensive approach to making sure that data quality is achieved across the board. Next slide, please. And here we're going to zoom in to our quality metrics that were developed and now already present in the NIMS toolkit. To the left, so in this blue table, here we're tracking during data collection the number of analyses of number of missing or don't know answers that are reported by each enumerator. These are important components to track during data collection if ever perhaps a questionnaire is not being administered properly, or the interviewees, apologies, are not understanding questions. We can track and see how complete is the data that we're gathering on a day-to-day basis. In terms of quality now control metrics, so in this now yellow table, here we have our survey results. So this is after data collection. And here we have 3 examples of some essential indicators that are key for Nutrition International's programming. Here we have a design effect. So this is the issue design effect that is a measure of heterogeneity across the clusters because it's applying a cluster design. And here we've integrated, thanks to inspiration from Stats Canada, a grade of acceptability. So we're using a traffic light system based on the coefficient of variation. I won't get into too many details on the statistical components of the coefficient of variation, but in essence, it indicates a magnitude of sampling variability and is related to the standard error. So we thought this would be an appropriate measure of quality where we can see whether a result is acceptable. So in green, yay, or marginal, which is yellow, or to be used with caution and hence red, where that may be problematic to interpretation and its utilization. We also have a number of different tools using this gradient that I'll speak to shortly. Next slide. And bringing this kind of traffic light system and how we can further enhance the NIMS tools, over recent months, we've conducted a needs assessment across Nutrition International's headquarters, regional and country teams to identify what is the need now for the incorporation of monitoring tools. So right now, the toolkit as it stands is really focusing on baseline, so at the start of a program, and endline at the end of a program, and looking at the effectiveness of their programming. However, we all know that monitoring data, so that's coming in on a more continuous, regular basis, would also be useful for course correction in terms of programming and to further enhance the achievement of the program's goals. So based on this needs assessment, we've identified some key gaps and areas to reinforce in terms of monitoring, as well as the need for a desk review that will provide us a landscape of various monitoring tools. Once again, not to reinvent the wheel, what are other people using? And we're just in the process of finalizing that to see which of those existing monitoring tools could be most appropriate to meet NI needs, and probably looking at a consolidation of a variety of different methods to add into the NIMS toolkit. We're also looking at some other considerations when it comes to sampling design and sample size with a number of rules of thumb. For example, if we have a number of cluster loss, or in terms of geographic spread and the use of weighing and stratification. So we're also developed a specific weighing note that can streamline the approach to data weighing for Nutrition International, when to apply weights, survey weights or not, to their data. And we're also in the process of building a dashboard to enhance data visualization and its utilization, whether it may be baseline surveys, endline surveys, or these up and coming monitoring surveys. So a number of components are still in the works, and now I'll hand it over to the much anticipated gender component. Over to you, Alison.
My name's Alison Riddle. I'm a PhD candidate at the University of Ottawa's School of Epidemiology and Public Health, and One of my co-supervisors is on the call with us and is the co-PI under the Campbell Collaboration for this project. Dr. Vivian Welsh is here. And I'm going to talk about our work on gender and empowerment and nutrition. Next slide, please. So I thought we would first sort of start with taking a step back and talking about, well, why is this important in the first place? And it begins from, I know this is Nutrition International's perspective, and it's certainly mine and my research, but the idea that good nutrition and gender equality are mutually reinforcing. So some examples here, such as a mother's level of education is positively associated with her child's health outcomes. And in fact, going further, level of education, the higher it is, may also convey women with greater confidence, influence, and bargaining power. Reciprocally, we know that good nutrition is really important for learning and cognitive development. And when it comes to economic empowerment, cash that is controlled by women is more likely to be spent on food and healthcare in the household. And women's heavy work burden, which can cause a lot of additional nutritional requirements because of their long and often physical work hours, can have a negative effect on their health and pregnancy outcomes, and can also limit time dedicated to childcare. Next slide, please. So this is a recent systematic review that I wanted to highlight to everyone that was done looking at the relationship between women's empowerment and child nutrition outcomes. It's by Marianne Santoso and colleagues. It just came out in 2019. There are a few other reviews as well, but this is the most recent. And they looked at 62 studies that assessed the association between a measure of women's empowerment and child nutritional status. And they found a lot of variation and 200 unique empowerment indicators that were used to assess 1,316 different associations. And the indicators used were inconsistent and often limited in scope. So in the end, they found that the evidence is underwhelming, but that's likely due to study limitations and not a lack of association. So there's a real challenge when it comes to measuring women's empowerment and relating it to nutrition in terms of having a lot of diversity in the types of measures that are used, how these studies are carried out, and then it makes it really hard for a systematic review to pull it all together and to create one point estimate to really quantify the relationship. Next slide. So these are some of the gaps that Santoso and their colleagues and others have identified. It's certainly not exhaustive, but I wanted to highlight some of the ones that we're using to inform our work. So they said that there were a lot of missing dimensions of empowerment. So a lot of measures and scales and studies aren't looking at things like time use, how women use their time, the impact of environment and sustainability, women's mobility, and political and psychological empowerment. There's also a real shortage of data sets that actually have indicators about women's empowerment and indicators about nutrition. So the exceptions are the DHS country data sets, which is the one that's used the most often, but is certainly limited because it's cross-sectional. And same with the Indian National Family and Health Survey data sets, as much of the research still comes out of South Asia relating, looking at women's empowerment and nutrition. Finally, there's a lack of a life cycle approach when we're talking about measuring empowerment and nutrition. The preponderance of studies and reviews really focus on child nutrition outcomes, but we're missing outcomes for women and for adolescents, as well as for older women who are no longer reproductive age. I just want to take a step back and talk about, well, what do we mean by women's empowerment? So this is a combination of a definition from a variety of scholars, the most notable being Naila Kabir, and then I also used some work from Alsop and Heinsohn for this. And we define empowerment as the ability to make and act on strategic life choices where such choice was previously denied. And there's 4 components to this. The first is agency and the motivation and ability to make and act on strategic life choices. Sometimes this is relates to decision-making, power, sense of autonomy, self-efficacy, those aspects of psychological empowerment. But in order to act on these choices that an individual or a collective have made, you need resources, and those can take a variety of forms. So it's either human, material, or social resources. So it could be money, it could be social capital, it could be a lot of different things, and these are necessary to facilitate action. The third piece, and it's very closely related to resources, is this idea of opportunity structure. So the context, the institutional context, formal and informal, in which choice is made. So that goes a step beyond resources, but is related. And then finally, the desired outcomes, so that the interaction between a sense of agency, access to resources, and a conducive opportunity structure can actually lead to the outcomes that an individual desires. So this is sort of underpinning all of our thought and the work that we're doing. So our objectives as part of this collaborative is to look at 3 different things, all interrelated, and relate back to some of the gaps we were talking about. So first, when it comes to the NIMS, and in response to Nutrition International's desire to have standardized indicators across countries, we wanted to identify a set of gender equality and women's empowerment indicators to pilot in the recent NIMS survey. The second objective we had was to explore more and try to explain the relationship between empowerment and adolescent girls' nutritional status. Again, getting at that challenge of having less debt. I wouldn't say lack of data, but less data on adolescent girls. And thirdly, we wanted to look at, well, how do you operationalize empowerment? What are some of the effective strategies that are being used within the context of nutrition interventions? And we're looking at 2 different groups for that. We're looking at women of reproductive age and adolescent girls, all in low and middle income countries. Amina Adham, yeah, so you're asking about the framework for defining gender equality and women's empowerment. Is it public? Well, I haven't published it, but it's certainly adapted from other sources. So yes, you can reference our presentation here and the original sources. And later on, I do have a logic model mapping out what is an empowerment-based nutrition intervention, which breaks it down a little bit more. And that is a resource that we've cited in the resources that we've provided to circulate materials. So you can also use that as a reference. Okay, so I answered that, I think.
Yeah, Alison, we can also batch questions as well for the Q&A portion. So we'll be able to follow up. I'll be sure to relay these questions.
Okay, great. Okay, thanks. All right, I'll keep going then. Yeah, so how did we go about these things? So the first one for the gender equality and women's indicator identification, very similar to what Victoria was saying, we certainly didn't need to start new. There's a lot out there. So it was about combing through what's out there and adapting it to NI's needs. So we did a literature review of studies on the association between empowerment and women and adolescent girls' nutritional status to identify what indicators are being used and what dimensions of empowerment those are hypothesized to represent. So once I go through these quick methods, I'll tell you where we are on each of these pieces. For the second objective, we decided to use exploratory structural equation modeling, which sounds very fancy, but isn't, I promise. And it's to look at that relationship between measures of women's empowerment that we use the DHS, the Demographic and Health Survey data that's available for most countries. And we looked at we've done 2 sort of different models, one for East Africa, one for West Africa. And we looked at that relationship, and I'll talk about that a bit. And then finally, when we wanted to look at how to operationalize empowerment and what are some effective strategies, we did 2 Campbell systematic reviews, which are formalized, very systematic approaches to doing reviews of interventions. And we developed a conceptual model that underpins that, and we are testing it through these systematic reviews. So what did we end up when we were looking at indicators for the NIMS, the gender equality ones? So we ended up identifying more than 20 studies and reviews that use some sort of empowerment measure in the health and nutrition sector. And when we looked at each of these studies, we extracted information on what indicators did they use to measure empowerment, what proposed dimension of empowerment, for example, is it related to economic empowerment, political empowerment, social empowerment, mobility, etc., and to understand what theoretical frameworks they were using to underpin that. And then from that, we also we supplemented that research with looking at the eMERGE platform, which I have the link at the bottom of the slides there, which is the University of California, San Diego, where they've put together this great database of quantitative measures for gender equality and women's empowerment. And they've actually scored them in terms of psychometrics. So they identify which ones have good reliability and validity that you can pull from. So what we decided was we selected 13 indicators from existing scales, primarily the Demographic and Health Survey, Women's Empowerment Module, and the Women's Empowerment in Agriculture Index, both with very good psychometric properties. And this is an example here of the dimensions that we included 5 dimensions for the 13 indicators, and each one is an example question out of the ones that were included for each dimension. So the first 3 are out of the DHS and are very standard, and you'll see them used all the time. So those first 3 dimensions, so looking at women's labor force participation, their asset ownership, so owning a house, owning land, earning cash income, their decision-making power on important decisions such as major household purchases, visits to family, accessing care for themselves. And then we added the time use one, which is one where people just aren't collecting data enough. And that's from the Women's Empowerment in Agriculture Index, which is a wonderful tool. So we added a question on time use, and we also added a question on freedom of movement. This again can be very context specific, but we wanted to capture these across the 10 countries that we were doing collecting the data in. So this is exciting because now Nutrition International is starting to build a database that we can start to look at what is, and defining their population that they're working with in terms of empowerment in different dimensions, which then helps you to determine where you might need to intervene if you can understand what's happening and where people are more disempowered. Okay, I think next slide. So in terms of looking at that relationship between adolescent empowerment and nutrition, on the right side of our screen, that's the structural equation model, which I won't go into, but the idea is to take these various indicators of women's empowerment from the Demographic and Health Survey, women's empowerment measures, as well as a few others that we wanted to look at from the DHS, and look at how they relate and how they represent an underlying construct. Because the thing about women's empowerment is that it's multidimensional. You can't just identify one indicator and say you figured it out. Even the 13 that we have, you haven't figured it out. It starts to point you in the right direction. So we wanted to be able to combine the various different measures and then look at what are the different dimensions that are available in the data around women's empowerment, and what is their statistical association with outcomes, nutrition outcomes. And so we looked at girls' BMI for age, their height for age, and their hemoglobin. And we're still building the model, finalizing it. We plan to report in the fall, but what I can tell you in the table on the left-hand side is that we pulled and tried to identify indicators in these 6 dimensions. And what we found was those top 3 kept on coming out as being significant in one way or another. The last ones the data weren't strong enough, that doesn't mean they're not significant. It might just mean that these indicators aren't good indicators for measuring the concepts that we were hoping they would measure. And of course, we're limited by what is available in the DHS. So there's certainly a question of we need to improve on some of these measures. And the other interesting thing is, while these dimensions kept on coming up country after country, their relationship with a nutrition outcome would vary by country, which makes sense because access to information, for example, may be quite high in one country and may not have a significant association with nutritional status, but it could be a very different, it might not be as closely related as another dimension in another country. So you would expect that variability because empowerment is very much contextually based. Next slide. So this is the logic model I was talking about. I apologize, it's probably super hard to see. But this is what's underpinning our systematic reviews. So when we decided to do the systematic reviews of what we termed empowerment-based nutrition interventions for women of reproductive age and adolescent girls, so they're two separate ones, we first needed to conceptualize, well, what does an empowerment-based nutrition intervention look like? So this is the model we came up with. It's purely theoretical, but then we're testing it through the systematic reviews. So just briefly on the left, you move from left to right. And so what we have said is that an empowerment-based nutrition intervention will have activities that are to foster agency in women or adolescent girls. They'll address the opportunity structure that they're working in, and within that, that includes access to resources. We combine them in this model. And then obviously you have the nutrition-related activities themselves because they are nutrition interventions. And we've hypothesized that it goes through these different steps on how empowerment then, in the shorter term will increase ability and motivation to make informed choices, and they create a supportive home environment so that women and girls can act on these choices, which combines with the increased awareness and knowledge and skills that they would gain from the actual nutrition related intervention. And it moves through, it follows the process of, many of you are probably really familiar with the UNICEF model for malnutrition. So that's the sort of right end of it, how it moves through with, in the middle there, looking at empowerment outcomes along the pathway. So improvements in decision-making power, access to resources, protection and fulfillment of human rights, again, can vary what dimension that's happening in. And also your intervention in terms of what you do for agency and opportunity structure are also going to be very contextually based. So what we're trying to do in our systematic review is to look at interventions that take this type of approach, identify how they're operationalizing agency, opportunity structure, etc. And then what effect is that having, trying to tease it out in terms of improving nutrition so that we can, one, find effective strategies for operationalizing the concept, and two, and when we talk about effectiveness, are they actually contributing to improved health and nutrition for adolescent girls and women? You'll see there's also a piece in the outputs, the second sort of column from the left. We want to really look at a very important piece is how these interventions are implemented, which will affect their effectiveness. So we really want to tease that out and understand those factors, as well as along the bottom, the contextual factors. And getting at even some issues around intersectionality. So trying to look at how different interventions are treating different socially disadvantaged groups as well, if there's any differentiation in terms of effects there. Next slide. So these are we're in the data extraction phase. We've done an exhaustive search for studies that would meet our inclusion criteria. For the women of reproductive age one, we have maybe 6 studies, but we're still doing gray literature searches. And for adolescents, around 5 studies. So it's not a huge amount. So very welcome if others can think of studies that we should be including. But this table gives you an overview of the ones that, some of the ones that we're including in the women of reproductive age. And what do we mean by agency-related opportunity structures, et cetera. So maybe I'll just go through 2 of them. So the Harris-Fry 2016 study So the nutrition, remember we said they would have 3 components. So the nutrition related activities is they're providing nutrition and health related education. Oh, don't worry, I'm almost done, Antu. I'll just do one. And then in the agency related activities, you see a lot of the approaches are around women's groups and to build agency. And then opportunity structure can really vary. So you could be engaging, for example, in Harris Fry 2016, they working with local leaders, community members, and men to create that supportive opportunity structure so that what women decide they want to do as part of participatory learning and action working groups, they have that sort of support. And they're in only 2016, they actually have agriculture production training, which is more economic focused. And Harris Fry 2018, for example, includes cash transfers.
Thanks very much. So I'd like to just change track a little bit now. You've heard a lot of the technical details around the work. What I wanted to do is just to have a few last slides around what the value add of this approach was to Nutrition International. So if we could go on to the next slide, please. So we've had the chance now to implement this toolkit in 9 out of NI's 10 focused countries in our most recent round of surveys. And we took this opportunity to get a little bit of feedback from both our country teams and also some of our long-term collaborators, because like a lot of organizations, we rely on consultancy organizations and other partners to run surveys for us in the field. And some of them we've been working with for quite a long time. So some of the feedback that we got from using this approach was really overwhelmingly positive. Some of our long-term collaborators were saying that this is really that using this approach is really great because it sets out very unambiguously exactly what NI wants in terms of its data, in terms of what we want from our surveys, but also what we regard as being good quality data. It makes it very clear that that this is what we regard as being an acceptable level of quality, an ideal level of quality, and what we would regard as being unacceptable for quality. But not just that, it also gives people the tools and gives organizations the tools to achieve that quality. So with all of the tools that Victoria was explaining earlier, it really sets organizations up for success. And I think one of the best quotes I've had back from this process so far is, you've given us the path and the tools and all the steps we need to take so we can do it with our eyes closed. And that's really what we're aiming for. We want to make it very easy for the organizations that we're working with to give us really good, high quality results. And that's what using this approach has provided for us. The other thing that it's from the feedback from a lot of the organizations that we work with is that it's given us the time to concentrate on quality. One of the things that Victoria was sort of saying about our approach earlier is that we are now able to do real-time data checks. We can identify outlier data collectors, we can give feedback to the teams, to the field teams, and we can correct issues while we're collecting data, so that we don't then get to the end of the data collection process and find that we had problems in the data collection only at the end. We're able to correct them in real time. But that's quite an intensive and time-sensitive thing to do. And it only really works if everything's running like clockwork. Well, the great thing is, if we use our toolkit in the way that it's supposed to, everything does run like clockwork. And so that's, I think, one of the big pieces of feedback that we got back from some of our collaborators, where it gives us the time to be proactive because we're not needing to be reactive. And then finally, the feedback around the gender piece, which was that, excuse me, I'm going to have to plug in, around the gender work was that the questions which have not yet we've not yet got the analysis from that because we've only just completed our rounds of surveys, is that the set of gender questions were very acceptable. The flow was great, and also that it didn't add to the burden of work for the survey. can go to the next slide, please. So, what are some of the conclusions? Well, it's changed the way that we work, and that's changed the results that we're getting. So, we've got ways of assuring and documenting the quality of our surveys. In addition to the consultant report, we now always produce a technical review where we can grade the quality of evidence and document the ways that, that we've assured quality against that set of criteria set out and validated by the University of Toronto. And the best quote that I can come up with to summarize that is silence. Let me explain that. Usually, when we finish our round of surveys, then the questions start. Then we'll get lots of questions from our program managers saying, well, where does this number come from? What's the provenance of this number, please? This number wasn't quite what I expected. So could you please explain it? Was there a problem with data collection? Or is this just really a result that I wasn't quite expecting? This year, we've had hardly any questions. I've been in the very strange position of following around program managers, asking them, are you sure you really don't want to know anything about the data? The feedback that we're getting is, we don't need to ask any questions. It's all there for us. In your all the data is it's very clear where it's coming from. It's graded. We really don't have any questions at all to field, which has been really great. It's also been very timely, and of course, then the big one. We're finally sort of now in a position where we can move forward with producing gender-sensitive data and trying to answer the question: how does gender equality and the gender empowerment affect our programs? In the past, we've relied a lot on gender disaggregated data, but of course, if some of our surveys are only asking questions of women, so we can't just disaggregate. Well, now we've got some more subtle tools and more subtle approaches to answering that question. So it's changed the way that we've worked. It's changed the results that we've got. And in the next steps, it's continuing to change how we work and changing the way that we work in NI. First thing we have to do, of course, is to incorporate all the lessons from that we've learned from this recent round of surveys, which of course is going to take some time to streamline, to really hone in on what made the difference and what we want to focus on in the future. The other next step is around the gender data. We're going to take some time to analyze that data, and so we can really sort of work out what are the effects of gender equality and gender empowerment on our programs, and how should we change our programs in response to that. So taking a lot of that very theoretical work and really moving forward to find very sort of practical ways that it will change how we program and how we work as an organization. So I think in conclusion to that, I think the best thing to sort of say about this project is that, and this collaboration, is that it's changed the way that we work, it's changed the results that we're getting from our work, and it's continuing to change even beyond the life of this collaboration, how we work as an organization.
Awesome. Thank you so very much, Colin, and everybody else for this very rich presentation. I know that this could be many hours long of a conversation, and what I like to say is that this is really the first taste of what the Canadian Collaborative for Global Health with respect to this project is like. For those who are on the call today, there will be more opportunities for us to hear how this project progresses, so please do stay tuned. I know that there are a lot of questions already around can a lot of the products you've already created, like the frameworks, be shared. So Alison, just wondering if along with the slides, which we will be sharing, and the recording, if that is the GEWE, the Women's Empowerment Framework, can be adapted to other contexts as well.
Yeah, definitely. I think that's sort of the key to it all. It has to be adapted to every context, because the way gender equality or inequities play out are very contextually based. So, you know, really adopting an empowerment model first comes with an understanding of where women and girls disempowered, where are they facing inequities. So it really starts at the beginning of understanding, you know, and conducting a really good gender-based analysis of the context. And you can use the women's empowerment framework, but also there are some great gender-based analysis frameworks for health sector, especially, that can be adapted to help you understand what's happening within a population. And then you can start to tailor interventions thinking about those components of empowerment that are appropriate. You know, so what would be appropriate for fostering agency? I think we're still trying to figure out some of that. Hopefully our systematic reviews will help that. Opportunity structure, very context specific. So yeah, it has to be adapted every time.
Well, perfect. Then that helps, because those will have access to that slide, and feel free to use it and adapt it, as Alison is mentioning. A few other questions related to that part of the presentation. How was working defined? Labor force participation?
Yeah, good question. I think Carol is referring to in the NIMS, the ones that we piloted. So yes, we did. So when we were looking at labor force participation, it was either working for yourself, for a family member, for someone else, but it was working outside of the home. And then the time use was to capture those that weren't technically employment and labor force related. But there's certainly ways of that sort of measure has to be improved. But yeah, it was around whether you work seasonally, full-time, for whom, do you earn cash or in kind? It was capturing that kind of data.
Well, perfect. There is one other question around that, and then we'll move to Clarissa's question. The question is, the agency elements are very contextual with respect to the model you shared. How do you see it being standardized across the countries? How can we have consistent measures, because DHS doesn't cover all?
No, I know. I'm not sure I have those answers yet. I'm still trying to muddle through that, and I'm constantly in this tug of war theoretically about how much can you really standardize, because everything is so context specific. So I think it really gets to, because it's multidimensional, and you kind of have to look at constructs and measure those using different indicators that capture the variability that can happen in different contexts. I haven't figured it out. Maybe somebody else has. And if you have, please send it to me.
Well, that's the best part about this collaborative. We are figuring out questions as we go every day, and I think the best part is being able to share that widely and see what ideas we can generate. There is a question from Clarissa around, how does dimensions like public engagement, networks, and control of resources are taken into account within this model? I think there are a few models that we could be referring to, but
yeah, I've just pulled up the question so I can answer it. Okay, dimensions like public engagement, networks, and control of resources and taken into. So I guess for me, those go into the concept of opportunity structure. So not totally. So public engagement and being engaged would probably fall under agency. So if you look at some of the interventions we've been seeing and the women's group interventions, which tend to be more building on agency, it's often around collective agency as well. You've got to think not just individually, but collective agency. And public engagement linked to collective agency is where I would picture it coming up, around agency in the framework. Networks and control of resources, for me, control of resources is around, so control also related to agency, decision-making power, access to resources more being under the resources component, and networks, I see that as very much linked to social capital in the opportunity structure component. But these questions are really good, because right now the model's very vague and it needs to be teased out more. So when you're asking me, I can see where we need to expand those.
If anybody else has anything else to add, feel free to jump in. But there is just one more question, and I think that'll be the last one we take. Feel free, however, audience participants, to email us your questions at metrics@canwach.ca. We'll have that up, and we'll be happy to relay that to this team, and they can answer those questions for you. So the last question, I find the opportunity aspect of your model is very interesting. Have you looked at the human development and capability approach? I think there is a lot of compatibility with what you're building here and all the work in human development and capability approach scholarship, HDCA.
So yes, definitely. A couple things that I've looked at. So you often see in interventions when people are taking a women's group and their agency work, it's often underpinned by a capability approach. So the theories that they're building beyond how they're operationalizing it through women's groups is underpinned by that. And I also think about the dimensions of empowerment, because we don't really have a firm definition of what those dimensions are. And the capability approach is one that sort of counters the 5-dimensional approach, which is around social, political, economic, etc. The capability approach and Sen's approach seems to actually fit it a little bit better in terms of access to information, decision-making power, control over resources, being a little bit more nuanced. And there was a great study by Pierre Pratley out of Georgetown, I think, who looked at comparing, if you're measuring women's empowerment and you try to group them according to the capability approach versus the 5-dimension approach, the capability approach worked much better. So I'm really starting to shift my thinking towards and trying, I need to embrace more of that question.
Wonderful. Thank you so much, Alison. This has been, we're at the end of our time, unfortunately, and it just goes to show how exciting an opportunity this has been to hear about the work of this particular lab up on the screen. I mean, you've heard a lot of different voices here today, and you can see all the different email addresses. And this isn't even exhaustive, but definitely if you reach out to us at CanWaCH, we'd be happy to put you in touch with any of the members of this lab. One of the questions that was raised in the chat is, kind of paraphrasing a bit about, where will this go, and will we be sharing this with our colleagues at Global Affairs? Absolutely, that's a key part of the work of the collaborative, is to be thinking innovatively and creatively when it comes to data challenges, particularly those at the nexus of global health and gender equality. And at the beginning of this session, Sara, you opened up with some comments about how being in this partnership has really afforded you the opportunity to work as partners, to challenge each other, and to grow as organizations. And at CanWaCH, that's absolutely been our goal with this initiative, and we know we're nowhere near finished. So very excited to follow the work of this lab over the next few months as different outputs come out. We'll be sure to share it with all of you who have been here on the webinar today. And we look forward to also having you join us, we hope, next week at this exact same time, where we're going to be having another conversation, not about the collaborative, but we will be talking specifically about the ways in which Canada and Canadian organizations have been responding to COVID-19 with a focus on data and absolutely issues around measuring the impacts on women, adolescents, and girls worldwide, questions about the long-term legacy of COVID-19 on our development work. These are all important topics that have come up again and again, and we look forward to sharing with you what we heard. And I'm sure we'll post a link in the chat if we haven't already for how you can join us, or you can also visit our website and register for that to join us next week. So on behalf of Antu, on behalf of Melody, on behalf of all of us here at CanWaCH, and also our amazing partners in the collaborative, thank you all so much for taking the time to join us this afternoon, and we look forward to continuing this really important conversation on the intersections between nutrition and gender equality over the weeks and months to come. Take very good care. Bye-bye.